So the flu is a virus. It's actually very common. It infects your respiratory system, and that means your nose, throat, and lungs. The flu is easily spread, and yeah, it travels through the air. This happens when someone who's infected coughs or sneezes. You can also catch the flu by touching contaminated surfaces, and then touching your eyes, nose, or mouth. The flu can really make you feel quite ill. Most people recover within a week, but it can be serious. In fact, it can even be deadly, especially for vulnerable people. A lot of people wonder, how long does the flu last? It's a pretty common question. Typically, the flu lasts about 3 to 7 days. That's the stretch when you'll feel the worst of the symptoms. However, you might not feel totally back to normal right away. Fatigue, that lingering tiredness, is super common, and it can stick around for up to 2 weeks. So yeah, listen to your body and give yourself enough time to fully recover. The flu comes with a set of telltale symptoms. And honestly, knowing what to expect can really help. It lets you be prepared and take the right steps. Fever is one of the main signs of the flu. It usually lasts about 1 to 4 days. You might also get chills along with the fever. A dry cough is another common symptom, and it can hang around for up to 2 weeks. Your throat might feel sore too. Headaches are pretty common, along with muscle aches and pains. Those usually last around 3 to 5 days. A lot of people mix up the flu with a common cold, and while they do share some similarities, there are definitely key differences. Understanding these can really help you choose the right treatment. The flu usually hits you suddenly and hard. A cold, though, tends to come on gradually. Flu symptoms are more intense with things like a high fever, chills, and body aches. Colds are usually milder. You might get a runny nose, sneezing, and a sore throat. So, yeah, knowing the difference can help you seek the right kind of medical advice. So, the flu is highly contagious. You can actually spread the virus before you even know you're sick. Most people are contagious about a day before symptoms even show up. And, well, you remain contagious for about 5 to 7 days after getting sick. Children, though, they can be contagious for even longer. It's really important to take precautions. Yeah, even the small ones. This helps prevent spreading the virus to others around you. Stay home when you're sick, seriously. Wash your hands frequently with soap and water, and try to avoid close contact with others. These simple steps, they can really make a big difference. So, the flu typically follows a pattern, and well, understanding this pattern can really help you manage your symptoms more effectively. The first phase is called the onset. This is when you first start to feel unwell, maybe a sore throat, a headache, or just feeling really tired. Then comes the peak. During this phase, your symptoms are at their worst. You might be dealing with a high fever, chills, and those awful muscle aches. Finally, there's the recovery phase. This is when your symptoms gradually begin to improve, and you start feeling more like yourself again. While there's no actual cure for the flu, you can definitely take steps to relieve your symptoms. First and foremost, rest is absolutely crucial. You've got to give your body a chance to fight off the virus. It's best to stay home from work or school. Also, be sure to drink plenty of fluids. This really helps prevent dehydration. Water, clear broth, and herbal teas are all great choices. Over-the-counter medications can also help. Pain relievers can bring down a fever and ease those aches. Cough suppressants can help calm that nagging cough. Just remember to always follow the instructions on the label. Most people do recover from the flu without any complications, but it's still super important to be aware of certain warning signs. You should see your doctor if your fever is very high or lasts longer than a few days. Difficulty breathing? That's another red flag. And if you experience chest pain, confusion, or severe vomiting, you really need to seek medical attention right away. Also, babies, young children, older adults, and people with chronic illnesses are at a higher risk of complications. For these individuals, it's especially important to see a doctor if flu symptoms develop. Prevention, honestly, is the best medicine when it comes to the flu. One of the most effective ways to protect yourself is to get vaccinated each year. Also, make it a habit to wash your hands frequently with soap and water. And if soap and water aren't available, go ahead and use an alcohol-based hand sanitizer. Try to avoid close contact with people who are sick. And if you do get sick yourself, it's best to stay home to avoid spreading the virus. These simple steps can really go a long way in protecting both you and your loved ones during flu season.